Good afternoon. Today is April the 9th, Thursday, April the 9th. I'd like to summarize the press briefing that we have today at the Center for COVID Situation Administration, or CCSA. This morning, the Prime Minister called a meeting of the CCSA Center, with all the ministers and high-ranking senior officials from all ministries involved via video conference. During this meeting, the Council of Ministers were also briefed on the latest update of COVID situation and the various measures introduced to remedy the situation, including the various regulations for inbound and outbound travel of Thai and foreign nationals, the current status of quarantine centers nationwide, and the serviceability of hospitals and medical supplies issue as well. The committee also discussed challenges and the ultimate goal to increase effectiveness in handling the situation. The Prime Minister during the meeting also highlighted the importance of coordination among stakeholders, the communication with the general public ahead of the measures announced, the management of information, and on adequate resources, emphasizing the effectiveness of arrival and screening passengers in accordance with public health guidelines and state quarantine measures. The Prime Minister also emphasized about the curfew, the compliance to the curfew, and asks everyone to respect the curfew and refrain from leaving home if not necessary, and so that there will be no need for additional curfew restrictions. Also highlighted at the meeting this morning was about the healthcare and early detection system of Thailand, the fatality rate among the infected, which stands low compared to other countries. Also highlighted was the issue about the budget that the government has allocated for economic stimulus packages in line with policies introduced by other countries around the world, and which is introduced only after rigorous consideration and extensive research. Yesterday afternoon, the Prime Minister also visited one state quarantine site at Patra Hotel on Ramanine Road in Bangkok, and he thanked the owners for providing the hotel as a venue for state quarantine. The important issue that I would like to inform, which has already been circulated in the news as of yesterday, and it is quite important for the foreign community in Thailand, is as alerted a few days earlier, following the Cabinet's approval, the Ministry of Interior issued a notification on April the 7th, 2020, granting permission to foreign residents residing in Thailand an automatic visa extension. Please note that the current measures under this notification are valid until the 30th of April, 2020, and further updates can be found at the Immigration Bureau's website, immigration.go.th. The measures under the current notification entail the following. Number one, holders of resident visas who normally reside in Thailand but are currently abroad and required to return to Thailand within a year of departure will be granted extension of their compulsory return deadline. They are required to return to Thailand once the situation improves. Number two, foreign nationals whose visas have expired on the 26th of March 2020 or thereafter will have their visas automatically extended to the 30th of April 2020. There is no need to apply for a visa extension at the immigration offices for this period, and they will not be fined 500 baht per day. When the situation returns to normal, they are required to file for visa extensions as soon as possible. Number three, foreign nationals who are due 90-day reports between the 26th of March to the 30th of April are temporarily exempted from reporting in this period until further notice. And number four, those with border passes shall be permitted to remain in the kingdom for now and will be required to depart within 7 days of the reopening of border crossing points. And once again, please be advised to follow announcements regarding immigration measures closely for any updates. Turning to the general situation in Thailand, the numbers today we have for new confirmed cases is 54, making the total number of confirmed cases, 2,423. New recoveries, we have a total now accumulated of 940 recoveries. The 2 new fatalities, making the fatality 32. The 2 new fatalities today, the information we have now is the first case is a 74-year-old French national who experienced fever, symptoms of cough, and had to use a respirator, and this is in Chonburi province. The second fatality case is an 82-year-old Thai national with fever of 38.5, and he had to use a respirator. This is in Samut Prakan province. For the number of cases nationwide, the top cities or provinces in Thailand remain. The first is Bangkok, the second is Pattani province, and the third is equally between Chonburi, Pathum Thani, and Phuket. And if you recall, yesterday we reported on the active search testing procedures held in Phuket province. Various provinces in Thailand have announced measures for their particular provinces. For example, Chonburi province has restricted travel to and from the province itself from the 9th of April for 21 days. And Bungkan province has done the same, restricted travel to and from the province from the 7th of April for 30 days. For the enforcement of curfew, we have 1,204 arrests of violators of the curfew. And for the searches of breach cases, we have 29,000 persons searched and 22,000 vehicles searched who are violating the curfew. The next issue is about the repatriation of Thai nationals abroad, wherein the main message of the briefing was that Thailand, of course, welcomes its nationals back to Thailand according to the proper procedures and health screening process, which will be strictly applied to all flights, and for entry into the state quarantine process in designated sites. There remains many Thai citizens in need of repatriation back, and we reaffirm that all Thai nationals abroad who need to return will be assisted in their return. We encourage all Thai nationals to contact the Thai embassies if not already done, and we remind for the cooperation upon return to enter the subsequent quarantine, state quarantine process. Right now, the capacity is 200 persons entry by air. The state quarantine capacity, however, will be increased to reach 3,500 rooms for local quarantine, and an additional 13,000, a site for 13,000 persons provided by various state agencies is in the pipeline. The next issue is about the medicine, Favipiravir, wherein 1,800,000 tablets have already been imported into the country, so there is no shortage for that. The average use is around 70 tablets per patient. For the N95 masks, today there is another 200,000 imports of N95 masks into the country, wherein the priority will be for hospitals and patients. The spokesperson also briefed on the reuse of N95 masks, which actually are most appropriate for medical personnel. The reuse procedure for medical use of N95 is through UVC ray heating of 70 degrees Celsius for 30 minutes, and this will allow the reuse of the masks for at least 4 times. The translation of the press briefing that you hear every day is, of course, a semi-live translation, but of course some words we have to repeat quite often to the general public. We know it by heart already, that people should restrain from going outside unless necessary, wash hands often, wear face masks or face shields in public, and keep contact with others to the minimum to avoid transmission of COVID or possible transmission of COVID to the elderly, to different persons, your family members, and the like. And of course, in this situation, all of us are actually in the vulnerable group. So this is all I have for the summary translation of the press conference. Just in closing, of course, we should continue to help one another, providing moral support to one another, as well as for psychological support, physical health. Exercising is important when you stay home. We continue to monitor the situation. We continue to provide the general public with a systematic type of information in a composed manner, composed but cautious and compliant. So therefore, if the conveniences are on the way down, unfortunately, we would have to sacrifice that normal, usual convenience. But however, we hope for compliance to go up according to all the measures announced by the government. Thank you very much for your attention, and thank you very much for your cooperation. This is what I have for today. Thank you very much. Stay safe from the Center for COVID Situation Administration, or CCSA. Thank you very much, and สวัสดีครับ
ครับกราบขอบพระคุณนะครับท่านรองอธิบดี